LMHRA, established in 2010 after the promulgations of laws by the National Legislature, now called the Liberia Medicines and Health Products Regulatory Authority. Thereafter, the regulatory body has been faced with several critical challenges and has well gained meaningful successes in curtailing and preventing counterfeit medicines and health products from the Liberian market. In addition, it continues to develop these core functions and purposes for its establishment and even reinvigorated its strength again with the coming into office in October 2019. Pharmacist Keturah C. Smith, Managing Director.
The LMHRA for short has a mandate in ensuring that all medicines and health products that come into Liberia are safe and of high quality and highly effective. So our mandate is to make sure that we get rid of all substandard and falsified medicines and health products from in the Liberian markets. There are a lot of challenges. There are a lot of system, I would say, that was already set up and put in place. It just requires more effort, which my team and I try to enforce. For instance, there were logistical problems. The LMHRA was not well known at that time, so we had to do more public awareness. The LMHRA was just kind of centralized in Monrovia, even though they had an office at Bon County, but it wasn't running well, efficiently. And the LMHRA was not at the major border points, which was my main focus, to try to decentralize the authorities' mandate and reach out to those border points where you'll see trades coming from other countries, neighboring countries, to try to strategize and see how we can combat falsified or substandard products that come in from those countries into Liberia. So what we did at first, it was to establish an office at the Rabos International Airport, where we receive a lot of pharmaceuticals coming in. We established that office 2020 May, and we deploy our officers there, and they have been doing quite well in making sure that products that come in, especially pharmaceuticals, have been registered with us, have been tested, and have been proven to be safe by our quality control lab. So the next office we established was at Bullwater side. We deploy men at Bullwater side because we are embroidered with Sierra Leone, and also you see a lot of traders coming in with pharmaceuticals to Liberia through that border. And because we cannot manage the whole border system, Liberia is a very porous country, so we have set rules and regulations that medicines and health products that come into the country legally should come through the sea border, the seaport and the airport. So that means any products or pharmaceutical that come into Liberia through the land borders, we classify them to be substandard and falsified. It's not allowed. So we deploy our men at Bullwater side. Currently we have an office that runs fully 24/7 at Bullwater side with our staff, making sure that pharmaceuticals should not just pour into the country like it used to be. We also have recently deployed people at the Ganta border to do the same process, to carry on the same process, because you realize that a lot of pharmaceuticals come in from Guinea. So we have tried to curtail measures that people that bring in these products should know that the LMHRA exists, and they are not allowed to bring in pharmaceuticals through that point because it's classified as falsified, and most times when we do our post-market surveillance, it's always substandard and falsified products that come through the borders. So that was one thing that we didn't have in place when I was appointed as the managing director of LMHRA. Secondly, we had a lot of challenge when it comes to logistical issue. So we had just a vehicle, and it was a major challenge for us. What we did was to contact partners, and the Global Fund was like ready to listen to us. Within a year's time, they provided a brand new Land Cruiser Jeep for us, and it has helped us a lot to move between counties and within Montserrat as well. So gradually we are trying to overcome logistical issues, even though they are still there. But for now, we have a Land Cruiser Jeep that we bought ourselves through our fees, that has been sent to the Ghana border to curtail movement. And also we have about 5 motorbikes, which was not available initially, has been also deployed at various counties. So that's how we try to combat the logistical issues that we were faced with. And then also when it comes to staff, because when you work with people, they have to be motivated. So you cannot have people you work with that need to do the job and they are not motivated. First of all, when I came, staff had complained that they didn't have any health insurance. So we have worked tirelessly making sure that health insurance are provided to our staff. And since I got appointed like 2 years ago, we have health insurance that have been fully running and been working well. Our staff are fully covered when it comes to health insurance. And also internet services at the office. That was one of the major issues that we were faced with. How can we send emails? How can we communicate with partners out there? There were no internet service at that point. So we have somehow fully supported the internet service that we have now. And it's being paid through the fees that we also collect. So when it comes to trainings and a lot of inter-collaborations with other regulatory authorities out there, we've been working closely with the West African Health Organization. We've been working with USP, USAID. They have been helping us a lot to provide support when it comes to the quality control lab reference standards. And also we were able to build a mini lab or structure at the King's Pharm, which wasn't there. We're renting at Concord Town, Sophie. So through our fees and through the initiative of myself and my staff, we were able to build a mini building at the King's Pharm where we presently have the quality control lab. And we've also received several supports from Global Fund USAID when it comes to chemicals, equipment for the quality control lab as well. Presently, we are building a state-of-the-art structure where we will have the 4 compartments of the quality control lab. We are hoping that that structure will serve as a state-of-the-art lab in the sub-region. It's not just going to be exclusively for Liberia, but in the sub-region as well. So we're also able to establish few structures when it comes to incineration, because we have a lot of substandard products and we have expiries that are in country. So we needed to somehow improve the standards at our incineration sites. So initially when I was appointed as well, we were in a building that was that we were renting as VP Road. So we were able to strategize and talk to the government to see need in helping us to at least have a building that we won't be able to pay rent for. So the government has been very helpful in that process as well. Presently, the building we are in is being fully supported or paid for by the government of Liberia, which I must appreciate fully, because we have more space to ourselves compared to where we were previously. And we're also able to get 2 buses for our staff, 1 mini bus for the quality control lab staff, and a bigger coaster bus for all the staff in general, just to help them, because all the time staff can just depend on their salary alone to transport themselves to work. We all know that we all are striving to make ends meet. So that bus will help to at least bring them to work and then take them back home. It will also serve as motivation to them as well. So, like I stated initially, when we came in, there were nothing much known or said about the regulatory authority. Citizens and inhabitants of the country didn't really know what the regulatory authority is about, and you cannot be trying to regulate things and then even the people that are using it don't even know what you are about. So what we first started to do was to erect billboards at strategic areas, and also put out jingles in simple languages and in our own vernaculars to just get the message across. This is what we are about. Don't buy substandard and falsified medicines in the market, and how can you identify it. We also try to combat drug peddling, which is a major issue in our society, try to discourage citizens and inhabitants of Liberia from buying these kind of medicines. We are still on that fight, and we hope in the nearby future at least it will be eradicated from our society, where you won't have drug peddlers around, especially in the capital city of Liberia. So what do we intend to do in the nearby future? We intend to extend the quality control lab, like I mentioned. We hope that within the next 2 years we'll have that state-of-the-art laboratory fully equipped and then functioning, that will be able to provide safe medicines to our people, because it's only when we test these medicines that we'll know whether they are safe and whether it is effective to be given out to our people and to ourselves as well. So we hope in the nearby future that lab will be fully functioning, and we also hope to completely decentralize the LMHRA, that every county we go to, Maryland, Babolu, they will know what we are about. We are still struggling when it comes to people knowing what the regulatory authority is about, because it's the same people that will have to give us message when they see things going wrong, when they see people relabeling expired products. So when they don't know who to report these instances, so it becomes very difficult. So we hope to also get that done in the nearby future as soon as possible. And we also hope to have our staff well trained, and because there are a lot of issues that as a regulatory authority we are still struggling with when it comes to meeting with international standards. So we are still hoping to have all our technical staff trained to full capacity as well. We are trying to sort out for support from our partners to see how we can have more trainings for our technical staff. And we also hope in the nearby future to have a citizenry that will help to bring out information that we will need and require to help the regulatory authority to be on top of their games when it comes to information, because these people are business people. So as you try to block another place, they'll always look for another way to go. So we also try to reach out to people, to always encourage them to reach out to us whenever they see something going wrong when it comes to pharmaceuticals as well. So we also try to reach out when it comes to giving information on adverse drug reactions, because that's what we are about. The pharmacovigilance department try to reach out to people when it comes to reporting adverse drug reactions, and that we are still low on, because most people take medicines, they have this bad side effect, they see rashes on their body, but they don't know who to report their situation or their case to. So we're also trying to reach out to hospitals, we're trying to reach out to the communities, that when you take medicines and you're having these kind of reactions, we are here to see what's going on with that medicine and to report to the manufacturers on issues that concern the medicines that were taken by you. So having said all of this, I would like to say thank you to my staff. First of all, I would like to commend the government of Liberia for their support, and also I would like to encourage business people to do the right thing, and not forgetting also we are hopefully wishing to see in the nearby future to have a manufacturing company that is fully that will be producing pharmaceuticals in our country. This will also help to reduce prices of medicines in our country, because most of all the medicines that we receive now are being imported. So we are encouraging business people to look into the market to see how we can have more pharmaceutical manufacturing companies being able to produce this medicine, high quality medicines in our country, to curtail the prices that we receive from business people.
With these achievements aligned, the LMHRA consists of directorates that help in making the regulations a success.
My major role is to ensure that the operations of the LMHRA is efficient and effective. In doing that, I advise our managing director on technical issues arising from the various departments, and as well supervise the departments in ensuring that the various documents that are coming from the departments are in the best position for our managing director to make a decision. In addition to that, I play lead on quality management systems here at the LMHRA. I also supervise activities on good manufacturing practice of pharmaceutical companies. I'm also a senior dossier assessor of medicine that are sent for marketing authorization to be approved by the authority. And I also facilitate and coordinate trainings where needed. These are basically what I'm involved with amongst many others, but they are the major ones.
This department comprises of various units. We have the premise, licensing unit, post services. We have the post-market surveillance unit, the waste management unit, and we also have our regional offices. We have our offices in the rural county, and we have our regional offices headed by a coordinator. So we do our work. We most of the time go on the field to make sure to get rid of street peddling. Those are selling in the buckets on the market table. Most often we are on the back because selling medicine on the market table and in the buckets, they are harmful to the health of anyone that take it, because these medicine require certain temperature to have them be more good, or we say more potent enough that when someone take it and it will get well. So we make sure we go on the street, get rid of street peddling, go to the drug, medicines, store, pharmacy, hospitals, dispensary, health center, make sure to check the product to make sure that drugs that they are using first are of good quality and are educated.
Evaluation unit, department rather, is a department that is unique to qualifying all products that come on the Liberian market. The unit satisfy it, turn it over to the managing director for approval before authorization to come in.
We have 3 cardinal areas. So we have the area of pharmacovigilance, which is a medicine safety and monitoring portion. And then we also have the units that deals with the regulation of clinical trial, because in it I would talk about research and development. So before a drug is being produced, it has to go through serial processes, which are the various steps in clinical trial.
Physical chemical lab, the medical, let's say, devices lab, microbiology lab, and that of cosmetics. Those are the 4 units that the authority envisages.
In order to fight against substandard medicines in Liberia, the LMHRA, through the auspice of pharmacist Keturah C. Smith, has successfully established key offices at the regional level.
Presently, we have 3 regions. The first region having to be where the office of the managing director is, that is Mosoralo, Grand Bassa, and Maigibi. And region 2 is Bon, Lofa, and Nima, that is being headed by pharmacist Bessa Anthony. And region 3 is Bombing, Kemo, and Bapolo, that is headed by pharmacist Tamad Morrison. And our responsibility is to coordinate their activities where they have issues from the federal region. They're supposed to relate to us, and then we can relate to the Inspector General, to the Managing Director.
In continued efforts to protect the Liberian people from the use of substandard, falsified, and counterfeit medicine and health products from crossing to Liberia, The LMHRA is exploring possibilities and opportunities to establish major outreach partnerships and coordinations with joint security forces, border health inspectors of Sierra Leone, Guinea, and Ivory Coast, in order to prevent, curtail, and arrest tons of these products from spilling in the Mana River Union.
Inspect the drugs. LMHRA. LMHRA. Inspect the medicines. LMHRA. We want good medicines.